India has one of the highest burden of cardiovascular diseases. And what is that burden? The burden is that we in India will have about 64 million coronary artery disease patients by 2015 end, and one-fourth of them will be below the age of 40 years. The second issue is that there is a 3 to 4-fold incidence increase of prevalence of coronary artery disease both in the urban and rural population in India. So basically this is a disease which is going to increase both in urban cities and in rural towns. So this is not a disease of only the rich or of urbanization. It's going to affect the poor people, and the reasons are multiple. We have a higher incidence of diabetes, smoking, and non-smoking tobacco is still very high, and more importantly we also have the burden of urbanization, which is a natural history of economic progress, which has its downsides, which increases vascular disease. So in short, coronary artery disease is possibly going to be the biggest killer in people in India for the next maybe couple of decades. Number two is that it is going to affect younger population, and in India we know clearly from various studies that people get affected with heart attacks 10 years earlier than Western population. Now what can we do about decreasing the burden of vascular disease? The first thing is that we need to clearly indicate to people to stop smoking. If anything has happened in the Western group of countries which has decreased vascular disease, it is the quitting of smoking. So actively encouraging quitting smoking, and most importantly in India there is non-smoking tobacco like gutka and things like that, which are extremely harmful to both vascular disease and cancer. I think it should be very, very strongly advocated. It's good that public space smoking is not allowed, but I think in the same way public space chewing of tobacco should be publicly banned. This could help in reducing a lot of tobacco-related disease. The second thing is the reduction of diabetes, and diabetes is linked to two issues. One is sedentary lifestyle, which is basically not walking, not moving, and having a sort of automobile based travel. The second thing is exercise. Indians generally don't exercise as compared to Western population, and that is another way where we can reduce vascular disease by increasing exercise. So exercise should be important to be told to children at school level, because you certainly can't start exercising at the age of 40. You need to exercise early on in life so that the exercise is maintained through the adulthood. And for that the governments need to create spaces like parks. Schools should be mandatorily having playgrounds so that children play in the schools, and this would decrease vascular disease. The third is making unhealthy food more expensive. For example, oily, salty food should be taxed by the governments, and so that would make it more difficult to people to procure, and healthy food like vegetables and fruits should be lowered in terms of cost so that people can access that better. Unfortunately, it's the reverse in most countries. To get healthy food is more expensive, and therefore people don't access it, and unfortunately create problems for themselves. The third most important issue is pollution, and pollution is a very important cause of vascular disease in India. And urban pollution is in the form of smoke due to emissions from vehicles, and this should be strongly curbed. We see the shift from petroleum fuel to CNG in many cities, which is a welcome change, and also vehicles should have very strict norms for emission, and shifting on to electricity and solar panels will definitely help in terms of reducing emissions. So I think if you have a four-pronged strategy of reducing disease of heart in India, I would think that banning tobacco is the number one. Number two, increasing physical activity is number two, right from the school level, and encouraging that and getting off from the sedentary lifestyle to a physically more active lifestyle. Third, decreasing foods that harm people and making it more expensive for them to access, like salty, sugary, and pre-packed foods. If the government taxes that heavily, that could make it more difficult to access, and access healthy food in the terms of vegetables and fruits would be important. And lastly, I think pollution is a big issue, and I think governments should take strong steps in reducing their emissions. So all these would decrease vascular disease in the country, just like it has decreased in Western societies. So we know that the first hour after chest pain or a heart attack, as we call it in layman's terms, is the most critical part of acute heart attack. Most people lose their lives in the first hour, and therefore the importance of what we call as the golden hour is critical. The first thing in the golden hour is the response of the patient, and this is a universal feature that people tend to say, oh, this is not happening to me, and try to ignore it, saying that this is some gas problem. They are unwilling in the middle of the night to wake up their spouse to tell them that there is a problem in the chest and call for help. So these are dangerous issues that people need to understand, and public education helps in making people understand that any unusual chest discomfort in a high-risk population, and I mean high-risk population means somebody who's diabetic, who has a family history of heart disease, who's overweight, hypertension, if he gets some sort of chest discomfort which is not usual, he should call for help. The second issue is, how do you call for help? If you look at the systems of care which has evolved in most of the American and European nations, it is a call of a number, and that number is 911 in, say, in the United States, where if there is any medical emergency or there is a break-in or theft or there is a fire, you call that number 911. Unfortunately, in this country, we still don't have a number to call for an emergency, and instead people call relatives, try to call their doctor or neighbors, which does not help in a medical emergency. What you need is access to a quick ambulance which will come and pick you from the door and take you to an appropriate hospital. Now, these systems of care are evolving now in the country. We now have a 108 ambulance, which is a government based but EMRI run ambulance, which is almost now available in most of the states of the country, and the ambulance services are rapidly evolving. Now, if you access an ambulance in, say, in a state like Tamil Nadu, you can access it maybe in an urban city, maybe in about 20 to 25 minutes, and in a rural town, maybe by 30 minutes. So clearly, those numbers of times are coming down, and I understand that EMRI and the ambulance services are reducing the times. This is critical, because once the ambulance comes, then the personnel can do the preliminary check, what is the problem, maybe get an ECG done, and transmit that ECG through phone-based technology or through app-based technology to an appropriate hospital, which can diagnose quickly. You don't need a doctor for that. An ambulance technician is good enough, and then shift very quickly and appropriately to a correct hospital, which is having the ability to administer good care. The hospital should be closest and the best for cardiac care, and should be accredited for treating heart attacks. That's the critical point. There's no point landing up in a gynecology hospital with an acute heart attack, because that's not going to treat you. So it's important that you get to a right hospital quickly. The third thing is that once you get into a hospital, once the doctors usually diagnose the heart attack, it is important to be in an ICU scenario, because if you get a change of heart rhythm, which is the commonest cause of death in an acute heart attack, unfortunately remaining in a room or a ward or at home is not going to help you, even if the doctor is standing by your side, because this requires a defibrillation, which only a defibrillator can give you. So it's very important to access a good hospital and get treated with acute emergency measures, which include medicines and appropriate treatment in the treatment of the golden hour of an heart attack. We have started what we call as a public-private partnership in Tamil Nadu. This is called the Tamil Nadu STEMI project, with government, 108 ambulance, and myself and Dr. Thomas Alexander from Kowai. We have initiated a pilot project which has critically decreased times to access for people for acute heart attacks, and shown clearly that if you put a systems of care together, we can decrease the events that follow the heart attack, including a hard endpoint of death. So it's important. The golden hour is very critically important, because more than 50% of people lose their lives in that first hour. It is important that people access the right care during that period. The third issue is the cost of cardiac treatment. Now let me tell you that these are evolving. Nowhere in the world do patients pay fully for their treatment in a westernized society. It has to come through an insurance. And the insurance is of two forms. One is what we call as a governmental insurance, which at least the states of Tamil Nadu, Andhra Pradesh and Karnataka are quickly onto it, and at least acute care like a heart attack or a stroke or pregnancy or a trauma is now accessible for people in many of the government hospitals and many of the private hospitals also. So it's important that the government legislate that acute care should be given to all people through an insurance scheme which is accessible to most people, especially the poorer, below the poverty line insurance groups. The second group area where is obviously the private insurances, which many of the richer people have, which they could access care without clearances, what we call as a cashless insurance in a term of an acute emergency. Because at that point of an acute emergency, trying to get a clearance before treatment is incorrect for patient treatment delivery. So I think it's very important that the insurance parts comes into process, and I'm happy to see that many of the states, the south and many of the northern states which have better economics are quickly getting the social insurance sector together for acute care. The second thing, these treatments are pretty expensive and are the cause for many of the rural indebtedness of people. So if you want acute heart care or acute cancer care or acute trauma care, many of the people who are not covered by insurance pay a huge amount of money by pledging all their resource assets and land, and that lands up in a perennial debt for the people. So it's very important that the government moves in. Currently it's only 1% of the GDP which the government pays for healthcare, which is possibly the lowest in the world, and I think a reasonable 3 to 4% in the next few years and about 6% of GDP spend on healthcare would be a reasonable spend to cover acute care and many of the chronic diseases. So paying out of pocket is not a great idea, but at this point of time most people are forced into it because they have no other way. But I think that's not where all about healthcare, and the government needs to spend more time and more money on public healthcare to see that people can access healthcare quickly. I am experiencing chest pain now. What should I do? The first thing is if you have an ambulance service which you can call for it, either public or private in your neighborhood. Because trying to call your neighbor or trying to call your spouse to help you to getting into is not a great idea, because you're spending very important time trying to get that resource. Calling your doctor again may not be very useful in an acute chest pain, because by the time the doctor comes and takes an ECG, a lot of time may be wasted. The doctor may be busy in his own hospital and getting there may be difficult. The most important thing is to get a good ambulance service quickly into your home. So try to put a number on top of your telephone directory which accesses an ambulance quickly in your area. It could be whatever the number, but please access that number. Once the ambulance comes in, then the ambulance people would know where to take you for the acute heart attack. And once an ECG is done, the diagnosis of heart attack is usually made. And then accessing a hospital is the most important thing. And as I said, accessing a good hospital which is accredited for treating acute heart attack is the most important thing. Because if you land up in a wrong hospital, then again you're shifting from that hospital to another hospital and you're wasting more time in the whole thing. So it's very important that the system of care is developed, and that's what we are trying to develop in Tamil Nadu. And I'm happy to say that the Tamil Nadu pilot project in multiple cities in Tamil Nadu has shown very clearly that this can be done in a country like India with vast differential treatment options available and vast differences of government, public, private hospitals available. And this can be scaled up in many of the states. And I'm happy to say that both Tamil Nadu, Telangana and Andhra Pradesh seem to be interested in scaling these projects up in terms of acute care and systems of care treatment. What sequence of medical tests? The single most important test is apart from the history, is an ECG. And an ECG is a very specific test and it's very easy to do. It is not a very expensive test to do. And this ECG, the interesting part, it can be done at your bedside, at home, or in the ambulance. It does not require, unlike a stroke, which needs a CT scan or something like that, where you need to get to a hospital. A ECG can be done at your bedside. The second thing, the interesting part of ECG, it can be transferred very quickly by today's technology onto another device, which is basically an Android phone, very quickly, where a distance-based consultant can very quickly diagnose heart attack and say that this is a heart attack. So it's easy to do and it's easy to send in terms of technology. The third thing is, if once that's done and the diagnosis is sort of reasonably confirmed, then you can do cardiac enzymes, which is basically a release of what we call as markers of a heart attack. Some of this are troponin and CKMB. And then you start initiation of treatment. And the initiation of treatment is according to a type of heart attack, what we call in medical terms as STEMI or non-STEMI. In a STEMI, which is the major heart attack, the treatment is basically giving aspirin, giving other antiplatelet drugs, giving a cholesterol reduction drug, and giving a clot-busting drug like streptokinase or tenecteplase. People who can access tertiary services in an acute heart attack, in a STEMI scenario, undergo what we call as a primary angioplasty. That means the treatment which is of choice is in an acute heart attack, getting you to the cath lab, opening the artery up with a balloon and putting a stent if required. So that is a process which is possibly the most appropriate, but unfortunately not very accessible in most rural towns because cath labs are not available, and most urban towns, because of the traffic, to get to a big hospital sometimes is a nightmare. So the most important thing is to access a smaller hospital and at least make the diagnosis quickly up and give a clot busting drug if required. In the smaller heart attack scenario, which is called as non-STEMI, all you need is medical treatment with heparin and the cholesterol lowering medicine and the blood thinners, stabilization, and following which an angiography can be done within 24 hours, for which you need to access a tertiary care and get treated. The advances in coronary artery disease management has been very, very substantial, and the heart attack mortality, which is about 30%, say about 20-25 years ago, has come down to less than 5% because of establishments of coronary care units, good medications, angioplasty, and surgical facilities. So today, acute heart attack can be treated very, very well with very low mortality and very low morbidity. And the most important thing is public awareness, access to healthcare, treatment appropriate hospitals, and to diagnose and to mitigate the problem quickly rather than waiting on it, and once the process flares up and when you're too far down the heart attack, then going in for care, which at that point of time may be pretty useless. So in my opinion, acute heart attack is a treatable condition, and you should access hospitals which can take care of you appropriately. And number two, to prevent acute heart attack, you need to take the right steps, which is basically prevention, including a good lifestyle, no smoking, control of sugar and cholesterol, healthy exercise patterns, and awareness and testing of the risk factors and treatment of them appropriately with medicines if you have them.